Hello, everyone. I'm Janelle Mose, the Advocacy Director with AARP North Dakota. AARP has been working to promote the health and well-being of North Dakotans and Americans for more than 60 years. In the face of the global coronavirus pandemic, AARP has canceled all of our in-person events until the end of the year, but we're finding ways to provide you information and resources to help older adults and those caring for them. AARP North Dakota recently sent out a questionnaire to older adults, and the top 3 concerns continue to be being infected with the coronavirus and becoming ill, lack of social distancing and or use of masks by people in my community, and going to local businesses such as bars, restaurants, salons, gyms, and grocery stores. On July 1st, AARP North Dakota hosted a telephone town hall with Molly Howell from the North Dakota Department of Health, who provided an overview of the state's response to COVID-19 and efforts to slow the spread. We're hoping today's short video will help address some of the continued concerns our members have about contracting COVID-19. With me today is Renae Moch from Bismarck-Burleigh Public Health and Desi Fleming from Fargo Public Health to provide an overview of local coronavirus testing efforts, provide you context for how contact tracing works on a local level and its importance to slow the spread of COVID-19, and to also talk about steps to help make healthy decisions to protect yourself and others. Renae and Desi, good morning. Thanks for joining me today.
Good morning, Janelle.
Good morning. Thanks for having us.
Absolutely. Thank you. So the governor announced the phased reopening of the state on May 1st, and on May 29th moved the entire state to green or low risk status. And the number of cases seem to be trending downward. But I'll start with you, Renae. Can you describe the number of cases you're seeing in Burleigh County right now? Are you seeing any trends? Who is most affected in terms of positive cases? Are you seeing a rise or a stabilization?
So for Burleigh County, we've actually been seeing an increase in the number of positive cases here in the past few weeks. We were used to seeing 1 to 2 cases a day, up to maybe 10 cases being our highest number in one day. And so the last few weeks, we've actually been seeing 8 to 10 per day, and our high actually came in yesterday with 23 cases in one day. And so I know that these higher numbers have alarmed some people in the community, and they're really generating some questions for us as to why we're seeing these increases. But something that people should know that may be impacting our higher numbers here is we are doing additional testing, community testing, mass testing here in Bismarck. And so our numbers for Burleigh County are obviously going to increase with the more tests that we're doing. We're finding more positives. Since June 19th, the State Health Department, with the help of the National Guard and then also us here at Bismarck-Burleigh, have been doing mass testing events. So we kind of expected that we were going to see an increase in cases here. One of the numbers that we're actually looking more at is the percentage of positive tests that we're seeing in Burleigh County. So how many tests are actually being run, and then how many of those are coming positive. When we look at our overall number, we're just about a little bit over 2% for our rolling average right now, which is somewhat consistent, maybe a little bit higher than what we've seen, but it's not at this point a great indicator of concern. Something obviously that we are continuing to monitor and will continue to monitor for future spikes. But yeah, we have seen increases, but we knew that would happen with our increased testing.
You know, thanks, Renae. I think that's a super important point. What are you seeing in Cass County, Desi?
Yeah, so currently in Cass County, we have around 2,400 recorded cases of COVID, with roughly 92% of those as recovered cases. We've had about 70 deaths. We have been doing targeted testing of those at higher risk for COVID infection. So we've been looking at specific occupations, working environment, or living situations to determine what groups we test. We also have been monitoring the epidemiology data from the North Dakota Department of Health to track positive cases and then conduct testing where it's indicated. The average age of individuals infected with COVID in Cass County was 45 years old, but recently has averaged around 35 years old. And deaths have mainly been in older adults and those with underlying medical conditions. As the largest metro area in the state and with the most long-term care beds, our numbers have been higher in comparison to the other counties in North Dakota throughout the pandemic. However, there has been a steady decrease in our positivity rate over the past month and a half. We are seeing a little bit of an increase now within the last week or so, which may be due to just people being out more, gathering more, and then some of those loosening restrictions.
That's really helpful. Can you describe some of the efforts that Fargo Cass Public Health or Cass County in particular has taken to help control the spread and really educate the community? I know Cass County has somewhat seen, the majority of the coronavirus cases, and I know the governor helped form a task force to respond to that. So other things that you'd like to inform the community about what you're doing in Cass County?
Yeah, so as you had mentioned, we did establish our Red River Valley COVID Task Force in the beginning of May. And one of our first tasks that we took on was to develop a targeted testing strategy. So to kind of prioritize the groups in order to best utilize our testing resources, and then to identify those positive cases and then use isolation and quarantine measures then to slow the spread. We've also had a really effective contact tracing effort in Cass County to identify those close contacts and monitor those individuals as well as active cases. We also provide education through the contact tracing process as well, and general messaging and education through our social media platforms. We do have a COVID resource page on our website with a lot of information that includes contact numbers for medical, mental health, food resources, as well as the links to the North Dakota Department of Health and the CDC COVID pages as well.
I think that's really excellent. Renae, are there similar efforts that you're seeing in Burleigh County to educate the public?
Yes, we are actually doing very similar things here. We have not had a specific task force working on a targeting testing strategy here in Bismarck for us, but we have opened access and provided additional access in the community to testing events here on a weekly basis. And so still doing those types of things, as Desi stated, with contact tracing efforts, and then educating the public on COVID prevention and practices to slow the spread, because that's still a very important part of all of this, is those prevention measures.
I think it's been a delicate balance. I think, as you indicated, folks get concerned when they see the number of cases start to increase. And you've talked a little bit about the mass testing that's been going on in Burleigh County. And often you hear the governor and other local officials talk about contact tracing. But can you explain to our members and other viewers how contact tracing works on a local level?
Sure. So in Burleigh County, we actually have many ways to get tested here. And once we get notified of a positive case, we are then reaching out to those organizations and letting them know that they are positive. Following that notification, our contact tracing process begins, and that's initiated by the North Dakota Department of Health. And so I know Desi has some things to add as far as the contact tracing process. And the targeting testing groups and such. So I can turn that over to her to talk about that a little bit more.
Sure, thanks, Renae. So in Cass County, we continue to have diagnostic testing for anyone who's had an exposure or is symptomatic. Those would be done at the local health facilities. We also have 2 static testing sites and a site at Family Health Care Center, and we use those for our targeted testing events that we do here. When positive cases are identified, they are assigned to our contact tracing group. So we do it a little bit differently, where all the contact tracers are on site at Fargo Cass Public Health. The staff then interview them to determine any close contacts. And just for a little bit of education, a close contact is defined as someone who has been within 6 feet for longer than 15 minutes, either at one time or cumulatively, to an individual who is tested positive. Those living in the same household as the positive case are also considered a close contact or a household contact. So all close contacts are then contacted by the contact tracing team for quarantine instructions, for monitoring and testing instructions. So we follow quite a large number of people for, that probably 14-day window.
That's really helpful information. Renae, I'm going to go back to you real briefly. I know that a lot of the state is really watching Burleigh County right now as a potential what you would consider hotspot. Are there upcoming opportunities for members or others in the community to get tested in Burleigh County if they're concerned, if they've been, exposed to coronavirus?
Yes, absolutely. So I know that the State Health Department has worked with the National Guard prior to do some mass testing events, but Bismarck-Burleigh Public Health has also offered drive-through testing And that will continue to be offered on Tuesdays from 11 to 12:30 p.m. throughout the months of July and August. And so there will be at least a weekly opportunity here in Bismarck for people to get tested. And I know we're looking at regional options as well. So people that are in the surrounding area of Bismarck-Mandan will be able to have some additional testing sites. We're going to be planning for that here in the upcoming week. And then, of course, portraying that information to the public once that's all finalized. But lots of different opportunities. I know the local clinics are also doing testing. We have a Northland Health Center, a federally qualified health center here that is also offering testing. And so plenty of opportunities if people are looking for that to be able to get tested here.
You know, one final thing before I switch back over to Desi. Does somebody have to be exhibiting symptoms in order to get tested, Renae? I know that's been a lot of information out there. If you're experiencing symptoms, obviously, yes, you should be tested, but there's been a lot of information about that. A lot of folks that are testing positive are asymptomatic. What would you recommend if someone's considering being tested?
So I know a lot of our cases, actually, I believe in the numbers that I had looked at, between 25 and 30% are coming back as being asymptomatic. And so we're catching some of those people that are coming through our mass testing events that way. So if someone is not experiencing a symptom, for example, but still has been out in the public and been active around other large groups, not keeping within their circle and such, we do have that opportunity for those individuals to get tested as well. And then we've been working with our local employers here and businesses. They've had some employees and some concerns about their own personal employees, and are they possible carriers, or have they had a positive case in their facility? They've been reaching out to us as well for testing in that case. So lots of our efforts right now are being focused on testing here.
Excellent, excellent. We're getting close to the end of our time, but Desi, what steps would you recommend to our viewers, in order to make healthy decisions to best protect themselves during this time?
Yeah, thanks. I think the best advice is just to be really aware of your surroundings and who you're with. If you can kind of attempt to stay within your usual family unit, limit your outings to necessary trips and attempt to go at off-peak times. I think some of the stores have, designated time for seniors, so that would be great to use those. Use online services for grocery shopping, things like that, if they're available, to limit your exposure. Wear a mask when in public. I know that's not popular with everybody, but it really is a good prevention tool. Wash your hands often, and if you can't wash your hands, have hand sanitizer when you can't hand wash. Maintain that physical distancing between yourself and other people. Clean and disinfect frequently touched surfaces, especially with your phone, door handles, things like that. Stay connected to family and friends through electronic means. I know this has been really difficult for people, and there's lots of loneliness, lots of frustration, things like that. So try to connect the best way that you can. Try be outside and maintaining that distance when you're outside. Do things to support your overall well-being, such as the healthy eating, exercise, again, being outdoors, getting adequate sleep, and then to notify your provider of any change in your health status or if you would have any symptoms of COVID.
I think those are really excellent ideas. We're, often need to be reminded to get outside, especially if those of us that are still working at home. Thankfully, I have a watch that reminds me to get up and move, to get outside. But I think those are really good reminders. I think being that we're in the middle of summertime, people want to be out and enjoying themselves, but they're worried. And I think those are really good tips about things they can do to keep themselves safe if they are choosing to go outdoors and be involved in the public. So is there anything, Renae, that you'd like to add that Desi didn't cover?
I think she covered very well all of the same things I would have for the prevention recommendations. I know a couple of things I would like to add is to remind people to continue to be diligent in following protocols. We've all been dealing with this for several months, and I know it's hard to keep in mind that social distancing is important, and wearing masks when out in public, is important, but it may be difficult to adhere to those recommendations, but it's more difficult to deal with the complications when someone has a virus infection with COVID. And so just kind of a reminder for that. And then to hit the nail on the head a little bit more about staying within your own circle, we're seeing a lot of contacts that, positive cases that are having greater amounts of contacts. So more individuals that we have to reach out to and contact, and that's causing increased workloads for the staff, obviously, but then obviously putting more people in danger and having them quarantine during that time is also concerning. So keep to your circle, as Desi said, and continue to do those prevention measures.
Well, thanks again, Renae and Desi, for joining me today. I think I've learned a lot today, and I hope our viewers have too. For our viewers, just a couple of quick reminders for you about AARP's coronavirus resources and other things that you can do to stay connected to us. First up on the screen, you have resources that are both statewide as well as local resources. So the ndresponse.gov webpage, as well as the North Dakota Department of Health webpage. You also have links on your screen to Bismarck-Burleigh Public Health and Fargo Public Health. Those will give you local resources and really follow up to give you tips and hints on how to keep yourself safe during the remainder of the summer as you venture out and enjoy North Dakota's outdoors. Staying connected with AARP, again, all of our in-person events are canceled throughout the end of the year, but you can find us here on our Facebook page, facebook.com, AARP North Dakota, or we have a lot of great resources on our website at aarp.org, North Dakota. Other coronavirus resources are available as well. So always keep in touch with us. If you ever need anything from us, we're just a click away on your computer. Again, thank you for joining us. Stay connected with us here online, and we hope to see you in person again soon. Thank you.